Dr. Andrew Roop here, and today we're going to have a conversation about fertility, about struggling to conceive, and about what are the missing pieces that I think is not talked about enough when couples are going through that journey. And I want to understand and acknowledge that this is a sensitive topic. This is an extremely heartbreaking thing that so many couples are struggling with. And in doing so, in talking about it, I don't want to make light of it. I don't want to write off all of the hard work and all of the many hours that maybe you personally have gone through in trying to go through that struggle to conceive. But within that, I'm willing to bet that there's a piece of it that's been missing and a piece of it that isn't really how most people look at this journey. Because most of the time, there is a big focus on hormonal regulation. And then rightly so, right? So much of our cycle and fertility, whether that's male or female, is related to hormone levels. And so there's a lot of testing, there's a lot of evaluation that is done for that. But I think we could do better to take a step back and, in a sense, focus on the overall health and wellness and realize that the best chance that somebody has of conceiving is if their overall health, their overall wellness, their overall well-being is at a better space. So in that conversation, the missing piece is usually the nervous system, specifically the autonomic nervous system, or the ANS. It's what runs everything behind the scenes. All of our automatic functions, things we don't think about controlling, things we don't have to consciously do, that is run through what is called our sympathetic and parasympathetic branches of the nervous system. We might refer to those as the gas pedal versus the brake pedal, sympathetic, parasympathetic. What we find is that most people, fertility struggles or not, are living in stress. They're living in a state where their nervous system is shifted into more of a survival or fight or flight mode. When that happens, it's going to affect everything. Your digestion, your immune system function, your sleep, your ability to focus and regulate emotions, all of this is going to be impacted. And one of those things is absolutely hormones. Just think about this from a very simplistic perspective. Our bodies are so smart. They're so well designed, they're so well made, and if our nervous system is perceiving the world as a stressful place, as a stressful environment, that's not a good time to bring another human into the world, right? If you were legitimately in a war zone, in a survival mode state, you wouldn't want to have a baby because that does not increase your chances of survival. So it's a wise design, it's an intelligent design, but that's not reality for most people, right? The stress that we're under, the gas pedal mode that's stuck on, isn't because we truly are in fight or flight or a survival situation. It's because there's other factors that have led to that. So what we want to do at Thrive here is actually measure how is our nervous system functioning. And we get to do that with one of our scans. This here is as easy as that is. You might be used to really invasive testing if you've been through this journey, stuff that I couldn't just hold up and show you, right? Because there's maybe surgery procedures or there's specific points in your cycle where you're doing blood work. There's really invasive stuff that needs to happen, but this is all we need to measure how well is your body handling stress. Are you in a balanced state, or is your nervous system shifted into more of that survival mode? Because if it is, we need to focus on that first. Yes, there's so many other pieces of cleaning up your environment and how does your gut and your nutrition influence your cycle and your hormones. And what are other things we can do to balance that out? We've done some of that with our own patients and in our own family. But the missing piece that is not talked about enough is the focus on the nervous system. And if I can go on a little side tangent, that's not just helpful for you trying to conceive. That's helpful if you're having an awesome pregnancy and you want to make sure your birth and your kid's health is going to be as amazing as it possibly can be. Because if you're stuck in stress, it's more often than not that birth doesn't go as it's supposed to, and you have more interventions needed, and more interventions at birth show up as struggles with kids, right? It shows up as a colicky, fussy baby that maybe has ear infections or is constipated and spitting up and on and on and on. So we can be proactive about making a huge impact, not just on conception in that fertility journey, but as that mom and that baby goes throughout their lifespan, by working on this, by making sure their autonomic nervous system, the operating system that runs everything else, is functioning as it's designed to. I know this is just the intro to this topic. There's so much more we could dig into, but if that sparks questions or thoughts, please comment them here, send us a message, reach out, because we would love to talk to you more about that. We'd love to, if that is you, do those tests, see how you're handling life, see if there's anything we can do to help, so we can make sure that nothing is getting in the way from your body functioning as it's designed to and helping your nervous system thrive.